Thank you so much for the warm welcome. Thank you to Dr. Bajpai and all the conference organizers. It's wonderful to be here. I'm going to focus on talking about addressing patient care and workforce disparities, and I'll mostly be talking about the workforce today. I want to just let listeners know that I don't have any disclosures related to this content. And I want to start with some concepts that really focus on the idea of how the world is built the world is really built for men. And this is an example. This book, Invisible Women, has lots of data-driven examples, really, really interesting. But this is an international problem, and it's called queuing, and women stand in line to go to the bathroom. And there are physiologic reasons for this. Women menstruate, and so it takes them longer to go to the bathroom. They often have their children with them. They may be taking elderly parents and so on. So when I think about this, I kind of group the people who want to solve this problem into two groups. And one group says women should. So we want to fix the women, somehow fix the women. And actually, we can do that somewhat. We could stop women from menstruating. We could do surgery on them. We could do all kinds of things to sort of make them go to the bathroom faster. That's the fix the women part. Now, when you really want to fix a problem like this, it really should be leaders should. So leaders should design bathrooms so that everyone doesn't have to stand in line, so that it goes quickly for everyone. That's a design thinking model. And that's not that hard to do. But for some reason, we're really stuck in sort of old structures and old ways of doing things, rather than thinking at a higher level and saying leaders should take this on, build bathrooms the way they should be built to accommodate all genders, and so on. That's one problem. Here's another one. This is a study that two of the people that I mentor did, and it's really interesting. And they looked at, they took surface EMG and they looked at how much pressure women versus men had to exert when they were doing surgery. And literally, women had to physically work harder. They had to physically make their muscles contract for longer periods of time and much harder. So women were literally physically doing more work than men based on their body size and type, etc. Here's a third example. This is a really important one. It's an evidence-based example. And in the literature for more than 2 decades, we have had this issue of women not being fairly represented on journal editorial boards. The impact of that is unknown, but likely profound. And one of the things that's really important about this example is it's a really easy one to fix. All you have to do as an editor-in-chief is invite a few more women, and in the United States, you can get them from lots of institutions, and often journals even have international editors. So it's really important to think about how easy this is to fix. Now let's talk about the structural part of it though. So even now, if editors-in-chiefs invite women to be on editorial boards, what happens is that they were designed decades ago for people who were wealthy and privileged. And in the United States, that's really wealthy men who are white, and they didn't have very much educational debt. And so what happens now is that we have much higher educational debt in the US. It's very costly to go to college and medical school and so on. And we have a lot of people who don't have as much privilege. So we have a lot of people who identify with one or more underrepresented group. And so the system that was built where people volunteer as editors and then ultimately get to the top and maybe get paid doesn't work really well for our current healthcare system. If you're a single mom who's raising 3 kids and you're a physician or a scientist and you're invited to be an editor, there's a good chance you're not really able to volunteer that time, so much time, without getting paid, because you have to pay off your educational debt. You have to take care of your children and so on. Even if you're married or you have a partner, it can be hard. So during this talk, I just want to say that I'm focusing really on what's happening in the United States because that's where my area of research is, and that's where I'm really a subject matter expert. But I want you to just think about what's happening in your part of the world as well. And I'm going to just pose some questions, and I think many of these are just universal questions. I also want to acknowledge that my work is primarily in gender equity, but I do some research and work in race, and I know race is different in different countries, so race as it pertains to the United States and so on. So I just want to make sure that everyone realizes that I'm looking at this and talking about this through a particular lens. So I want to just give 4 suggestions for what women might want to be thinking about. And I do a lot of work in oncology, so it's wonderful to be talking with you all today. And the first thing I wanted to say is when you're confronted with a challenging work situation, and we all are confronted with these, very often, figure out a way that is strategic to handle it. And I think that's a really helpful thing to do because a lot of people just kind of jump into it and say, oh, I'm just going to handle things the way I always handle them, instead of kind of leaning back and saying, wait a minute, how could I handle this strategically? If you're trying to drive change, especially big change in healthcare, there's really 3 angles that you can adopt strategically. One is the clinical, and this is better for patients, so we really need to do it. Another one is the ethical. This is really the right thing to do. We need to do this because this is the ethical or moral reason to do it. And the third one is financial. This makes sense financially. We need to do it. The financial one always works the best, at least here in the United States. So when you're trying to solve DEI or diversity, equity, and inclusion problems, a lot of times what happens is someone says, let's form a task force and let's ask all the people involved, the stakeholders, to volunteer their time so they're not getting paid. And we'll have them sit on this task force and offer recommendations. And a lot of times that doesn't work. In fact, things can get worse rather than better because the task force, the leadership is saying, oh, don't worry about that. The task force is dealing with it, no problem. And yet the task force doesn't really have a lot of power. Often they're not supported financially. They can't really drive change. So that model, which is used all the time, is not super effective unless you combine it with really giving that task force power and also making it data-driven so that you can see changes and financially supporting them. So again, when you hear these words, women should, that should make you take a step back and just say, wait a minute, that's probably not the right term to use, but this is common advice. So women should lean in. There's a very famous book called Lean In that many people are really thinking about and sort of have been told that you need to lean in, you need to be strong and so on, speak up, negotiate, do all these things. But if you lean in all the time, one of the things that you notice is that it can be very harmful to you and to your career and so on. So leaning in has serious consequences and you have to think that through. Let's talk about it with regard to pay. Women are told constantly they need to negotiate better pay. And one of the problems with that advice is that they really aren't in a powerful position. First of all, usually they don't even have access to the data. They don't even know what is fair to negotiate. If you don't know what other people are being paid, and you don't know what benefits they have and so on, it's hard to put yourself in a position where you can lobby or negotiate for better pay. And also, not only that, but just imagine, you're right at the beginning of your career, you don't have much power, you're trying to get a job. There's a power mismatch. And in that power mismatch really lies a lot of problems with regard to negotiation. So if we change it from women should to leaders should ensure that people are paid fairly. If they're doing the same or similar work, they should be paid fairly. And in the United States, we have federal laws that guide that. And increasingly, state by state, they are passing laws to try to reinforce that. Now, that doesn't mean we have pay equity. We don't. But it does mean that more and more people are realizing that it's not working to just say that women should negotiate and that we should have pay equity through the legal system. So, Instead of just saying lean in, what I often say to people is really you have three options, and lean in is one of them. And I do lean in, and I do think that it's a good idea sometimes to lean in. Sometimes, though, it's better to lean around and up. Sometimes it's better to say, this person just isn't going to support me, but there's another way I can get this done, and I'll figure it out, and I'll just go around that person. And then sometimes it's not really strategic to go around that person or to lean in and have tension with that person. So sometimes I say, just sit tight and wait. Just wait it out and see what happens next. And all kinds of things can happen next. The person could retire. You might get a grant that funds the work that you want to do. You might decide to leave and go to a different job. I mean, all kinds of things can happen. So there's always three options. So, kind of like what I know now that I wish I would have known from the start is just how powerful financial arguments are. That task forces often make things worse and not better. And so task forces really should be used strategically. And that there's a large body of evidence demonstrating that talented and qualified women, are rated lower on surveys and perceived as lower and so on. And so somehow we have to really recognize that and in our own surveys and our own responses, really acknowledge that we all share some bias, and that women are probably more accomplished, more intelligent, funnier, nicer than we perceive them to be. And then also just using hard skills. Soft skills are those things like empathy and so on. Hard skills are things like, how to do data analysis well, or very specific things that you can list. And we need to emphasize women's hard skills, especially when they're seeking jobs and so on, because that's really what employers are looking for. They're looking for hard skills, not that they don't want people with empathy, but they're looking for those hard skills on that CV or for that award or for that grant. They want to know that someone is accomplished and can do these certain things. So I just want to give people the opportunity to think about and, share, what do you know now that you wish you would have known early in your career? And I think that's really good to kind of step back and say, wow, I have learned a lot. I have figured out a lot. Not that we're not lifelong learners and that there's not more to learn. Of course there is. So the next thing I want to talk about is that great ideas are everywhere. And when you become a leader and as you go up, what happens is people come to you with all these great ideas. You work with all these smart people and they say, oh, I have this idea. It's going to be great. And they tell you this idea and you're in this position where you can't implement all these different ideas. There's no way it's not going to work. You don't have the budget, you don't have the time, and there's so many good ideas coming at you. And so when I talk to our faculty at Harvard Medical School about, sort of what it means to take a great idea and really bring it to something that actually is great, because there are so many great ideas, that really what you want to do is bring it through this innovation life cycle and think about, developing an idea culture, and then developing the engine that helps support those ideas, and then figuring out how to disseminate that once you do that. And the hard part is really the middle part, where you have to build this engine that really puts together great ideas, and not all great ideas, just the ones that can be done. So when the faculty come, it's sort of like cats, and they're saying, this will be great, and this will be great. And the cats are everywhere, and you have to kind of figure out what works. So one thing that I did was I had an idea about really doing an oral history project with polio survivors and having them tell their stories. And then I recorded those stories and I pitched it to the National Museum of American History, which is a big museum in Washington, D.C. called the Smithsonian. And I told them that the 50th anniversary of the Salk vaccine was coming up and that we should do an exhibit. And I had this wonderful content and so on. And it happened. And it happened because there were a whole bunch of things that strategically I did. I implemented the idea. I didn't just say something. So as I work with our faculty, I realized that we have all these centers and programs and institutes in our hospital and across our system. And we didn't really have a list of them. There were just so many, we didn't have a list. And also people didn't really know what was happening. Leadership didn't know what was happening. They didn't know if they were if they were profitable. They just didn't know all these different things. So I developed something that I called Project ICE, and I often name my projects in part so that I can put it on my curriculum vitae, so I can put it on my resume, and also so the people that work with me can put it on theirs. And the last reason is so that when I talk to people, that I have a name for it, that they remember it. So Project ICE is Institute and Center Enhancement. So Project, Institute, and Center Enhancement. I interviewed the directors of these centers and institutes, realized that more than 60% of them didn't even have a business plan. All of them predicted growth, which was fascinating. Every single one of them predicted growth over the next year. 77% had no growth the previous year. So how can you have growth if you have no business plan and you didn't have growth the previous year? It doesn't make sense, right? And these are really smart people. So really what I was just doing is helping them to think this through strategically and to have a plan. And so I developed these tools for them, really a toolkit. And I just basically said, here are these things that we need, and here's how to think it through. And I literally just walked them through it so that they would start to see, oh, and if they came up with a new idea and they said, I have this great idea for an institute, that they'd have to walk through this process. And if they had an existing institute and they wanted more money or more support, again, I would have them walk through the process and just start to see, okay, wait, if I'm going to build this, if I'm going to actually accomplish something great and do the next thing, then I have to think strategically, and I have to think more like a business person and make sure that I'm not just saying that this will be a great idea and hoping for the best. So there's a famous quote that says, hope is not a strategy. And I think that's a good one for all of us to remember. The fence sitters, those are the people that you have to convince, and that's who you have to spend the most time with. And so when I talk to a group like this, who's primarily women, I know that it's going to usually be a very warm, receptive group. And that's wonderful. And you definitely want to spend time with your colleagues and people who think like you, and people who can work together and so on. But to drive change, you have to move outside of that inner circle, and you have to really start working with people who don't agree with you. Otherwise, you can't drive change. It's very hard to drive change if you're not talking to and meeting with people who don't already agree with you. And that's where a lot of ideas and businesses and things like that die in what's called the chasm. So you have to cross the chasm. And as you cross the chasm and you try to get the early majority on board, those are people that are often very reasonable, very nice, and they just want more data. They want to understand something better. Those are the people that you need to meet with and present data and explain things to, and take some time. And so as you try to drive change, remember that if people already agree with you, those are the ones that you don't want to spend as much time with as the ones that don't agree with you, but you want to find that early majority. If you sit and spend a lot of time with the laggards, the people who will never agree with you, you probably won't get anything done, and you'll probably be really discouraged. So somehow you have to identify reasonable people who are not quite on board, need more information, more time, more data, more explanation, and that's how you drive change. So define the value proposition. It's really just a business term where you're just explaining, what's going to happen. If we do this, the value in this is X, Y, and Z, and here's how that will happen. It's really helpful to learn to analyze the no's and to understand why someone is telling you no. Once you start to figure out, wait a second, what's happening here? Why is this person telling me, no? Then you can figure out, the next steps. So if you want to have time for yourself, this is my final kind of tip, and then I want to go into how we're going to solve some of these disparities. If you want to have time for yourself and your loved ones, do some math, and you're all good at math. You know how to do basic math. And this is basic math, by the way. So How to Live on 24 Hours a Day is a really famous book. It was written more than 100 years ago, became an international bestseller. And really, the same thing is true today. Women have time poverty We're really busy. Time is like super important to us, and we have too little of it. And so we're not going to be able to have more than 24 hours in the day. So we're going to have to figure out how to work within that time. And so as you kind of think about things, and here in the United States, one of the things that we do is we say, okay, we're going to order groceries online, save money there, hire someone to clean our house. That's pretty standard. Here's what's not standard, though. What's not standard is someone just saying, I'm going to hire somebody to work on my manuscripts or reports. Instead, what people in the United States think is, my job should take care of that. My job should hire that person. And if the job doesn't hire that person, then they don't have it. And I think that's a really important thing to think about, because you have to say, well, if my job doesn't hire that person, that might not be fair. Maybe they should be hired. Maybe, it's not fair because men are getting more support and so on. But is that going to be a limitation of the work that I do? Or am I going to overcome that by just paying and saying, I'm going to hire someone to help me do my work? So those are decisions that I think are really important, and those are strategic decisions. I don't have answers for people. I think it's an individual situation, individual decision based on your situation. But I do think it's important to go beyond and start thinking about how you're going to get yourself more time. And so, in the United States, this wouldn't be a lot of money. It certainly is a lot of money if somebody has high educational debt and so on. But, if someone's paid off their debt, if they have a fairly high salary, this wouldn't be a lot of money, and they could buy themselves a lot of time this way. What about moving closer to work? So if you think about, well, what if I move 15 minutes closer to work, or alternately 15 minutes further away? What would that look like? And if you just do the calculations, and this is based on sort of, how we would work here in the United States, that's a lot of time. So if you said, all right, over a decade, I could get back more than 1,000 hours to spend with my kids, or I could get more than 1,000 hours back to exercise, or to, travel, or whatever it is that you want to do. That's a lot. That's a lot of time just for a 15-minute move closer to work. So just pausing again and thinking through, what are some of the strategies that you've used in order to have more time for yourself and your loved ones? And are there opportunities that you still could do more? There are other ways that you could change things. And then how much did it cost financially? And was that worth it to you? And what would you recommend for other women? Are there things that you've thought of in your system, or in your specialty, or whatever, that have really worked? And just to start sharing ideas and networking, that can be so helpful. So as I do work in the, thinking about disparities and so on, I often just group them into patient care and workforce disparities. And that's an easy way for people to see, how the work kind of breaks up. And then I start thinking about the relationship between these, because a lot of times the people that care the most about disparities are people who come from underrepresented groups, people who have suffered some level of oppression themselves. And strategically, again, in order to convince anyone to be on board and to support you and help you, you have to start with why. Why are you doing this? Why is this important? Why should anyone care about this? And then there's tipping points, and these are the hard things. And I will show you an example of a tipping point, but these are hard to figure out. But once you have it, it can drive a lot of change. And you want to leverage your network and manage the change process to the best of your ability, which, big ideas and big things, it's not like you can manage everything on it. But then you want to tell a compelling story. And I think that's really important. And if you can, publish. So this is an example of a storyboard, and I use this with our faculty, and I'll often just put it on a slide, and then I'll tell them they need to fill in these boxes and literally just create a slide that tells the story and reminds them kind of what the story is. And there's these different parts of it. And the reason why it's important to tell a story is, number one, people like stories, but they don't like just big, long stories that especially when you're trying to drive change, people, there's always different people in the audience, and the CFO, the chief financial officer, is going to be like, I don't want to hear a story. I just want to see the numbers. And, so you have to have different people in the audience that you're talking to, and that's why like weaving these different parts of the story can be so compelling. And that's really, I remember one of my mentors said, if there's one word that sort of, will help carry you through, it's that word compelling. Make it compelling. So I've been thinking about this a lot, and we talk a lot about this idea of the triple aim. And the triple aim is in healthcare is really hard. It was developed by the Institute for Healthcare Improvement, and it really is about value-based care. And these three things have to happen at the same time. And it's easy to have one of them happen, and it's pretty easy to have two of them happen. But driving all three of them at the same time is really hard, in part because it's hard to make patients happier with less cost. And that isn't an equation that works really well. But this triple aim is really a math equation, and it really does have numbers behind it. And so if we apply it to the workforce and we think about equity in the workforce, this is really about pay equity, promotions that have to be equitable, and also just having a safe and supportive workplace environment. So if we're going to do all of these things, and this is where we have to go in the future, because it's not enough to only do one, but I'm going to just talk about them briefly together and just kind of weave this together. So if we talk about pay equity, we know that this is a global problem. We know that women are not paid as well as men. We know it starts early in their career. We know it lasts throughout their career. We know it costs women, especially women physicians and scientists and administrators and leaders, millions as we add up those numbers, and that it's primarily documented by women, and it seems to be worse with debt. So this is just an analysis that I did. It's a conservative analysis in neurology in the United States for U.S. Public medical schools, and just this disparity as over time really gets into the millions. If women had been given the money that they deserved early on in their career and had been able to just invest it conservatively, they would have had a lot more money at retirement. And it's kind of baked into the system. So the examples I showed you right at the beginning of this talk, where things are just baked into the system, and people think that, it's fine for women to just stand in line while men waltz into the bathroom, and it's fine for, editors to mostly be men, and all of this, that those things that are baked into the system. That's what this is. And this is really important. This is just RVUs. And, the difference between a biopsy of a penis and a biopsy of a vagina really isn't that much different, but people get paid differently. And a big part of that probably, and that's what this study is showing, is that there's more women in OBGYN, so they're the ones that are doing the vaginal biopsies, and more men in urology, so they're the ones that are doing the penile biopsies. So, even though it's a very similar procedure and has similar risk and skill associated with it, there's a big difference in pay. And in this study, what I wanted to show is really that women are the ones that are talking about, issues with regard to compensation, and women are doing the compensation work. So they're both doing the work and also doing the work of disseminating it. So doing the work of studying it and doing the work of disseminating it. And that most of this work was not paid for. And this is really a study just looking at compensation studies. Now, why is that important? Well, if women are the ones that are doing the research on compensation, and they're the ones that are disseminating that research on compensation, and men are the ones that primarily make decisions about compensation, there's a disconnect there. And I was thinking about the study before I did this study. I kept thinking about this idea of pay gap deniers, people that deny pay gaps. Pay gaps are an international problem. And to me, it was mind-boggling. It was, how can people deny that women aren't paid fairly? Because it's an international problem. It has so much research behind it. I mean, we just know so much about it. And why would anyone argue that women are paid fairly? And so I kind of wanted to show this disconnect in the research, especially as it applied to physician compensation. So now as we think about it, we say, okay, well, fair pay is really important, but we also have to think about debt, and that's important too. because it's really financial stress, and women are making these decisions, for compensation based on their financial stress, or they're making decisions about what they're going to do with their family. And of course, pay gap, you can't solve these problems unless you promote. And so we've got to promote people equitably. And this was a study that was done in 2020 in the US. And this was a very, very discouraging study to look at, and to know that we had made so little progress. So this just tells us we have a lot of work to do. We cannot get to, we cannot achieve what we want to achieve without promoting people. We also have to deal with our work environment. Our work environment is rife with harassment, and that's something that that a recent study from a big government agency published in the U.S. and showed that in medical schools, in particular, that in academia in general, that harassment, and that includes but is not limited to sexual harassment, but that it's really high in medical schools. And I wanted to just share with you all that this is really an issue with a few people who are perpetrators and doing this, but not being stopped. And so one perpetrator can affect a lot of different people, a lot of different targets. And that's really important. So we have to stop the perpetrators, because it's not that all men are bad. That is not the message. It's not even that most men are bad. That's really important to understand. It's this small number that are kind of poisoning it for everyone, and literally can affect hundreds of people. And so at the National Institutes of Health, Dr. Collins really came out with this strong statement and said, we've been part of the problem. We have to be part of the solution. This is really an important area that we need to fix. And so this is something that is a big focus. Not that we've solved this problem by any means, but we realize that we have to. And again, this gets back to the AAA. So a few final thoughts. COVID has made things worse. We know that, people are struggling with this. This is a report that came out really looking at it with regard to women specifically, and women of color who come from underrepresented groups, and just recognizing that they have more barriers to deal with, and that COVID has just exacerbated this. So really important to recognize that. This is a true story of a group of women who wanted to get, a group of women physicians who wanted to get a lactation room at a conference, and had a task force essentially, and spent a lot of time on this. And this is such an easy thing to get done. You just you literally call the hotel and say, book this room, and make sure there's a fridge, and make sure there's a lock on the door, and there's a cost to it, and so on. So this idea of having a lot of really smart women working on a simple problem like this, that literally could take one phone call from the chair or dean, is kind of silly. And we want to stop that sort of thing. And so, I just want to kind of leave you with this idea of solve the problem and stop wasting women's time. Women have time poverty, and we really need to stop wasting women's time. And I do think it's important not only to think about early career women, but also the mid-career and the senior women who didn't have all of the opportunities and support, and now can benefit from them. So now is an important time to offer women at every level support. The Give Her a Reason to Stay in Healthcare campaign is a campaign that we launched this year, associated with the Harvard Women's Leadership course that I direct. It's a really great leadership course in terms of bringing together a lot of different women and skill sets and so on. And we really focus on core competencies in leadership. And so, this initiative is really focused on making sure that we recognize that a lot of women are leaving healthcare, or they're cutting back their hours and so on. And I wanted to share this with you because this physician tweeted this, just recently, a day or two ago, and basically said, look, we've been talking about this, we've been thinking about this, and we think it's important. The world was not built for many of us. And so we have to still live in it. We can't have a totally different world. We can't change everything. It was not built for us. And I think just acknowledging that we're not imposters. We're living in a world that literally wasn't built for us, and so we have to navigate it. And the wonderful work that the colleagues in India and the conference organizer and everyone is doing is so important. And I hope that you all keep doing that wonderful work. And I really appreciate being here today.